We would like to talk about the measurement of fasting blood glucose, sugar, levels and postprandial blood glucose levels. When does a diabetic patient have to measure blood glucose levels?
This is a simple question, but the answers can be long. Personal measurement data would be helpful for doctors to understand the curve of glucose levels within a day. Typical measurements include measuring fasting blood glucose levels immediately upon waking, postprandial blood glucose levels 2 hours after meals, and another test before sleeping.
Why does a diabetic patient have to measure fasting blood glucose levels immediately upon waking up?
The fasting blood glucose level keeps dropping after waking up. The consistent measurement of the same condition is desirable to track the fasting blood glucose levels. Within 5 minutes of waking up can be a standard. The reason for measuring fasting blood glucose levels is to avoid hypoglycemic shock. The expected range for a diabetic patient would be from 70 to 130 mg per deciliter. Generally speaking, when the blood glucose level is less than 70 mg per deciliter, patients should be careful of diabetic shock.
Why does a diabetic patient have to measure postprandial blood glucose levels?
The reasons for measuring postprandial blood glucose levels 2 hours after meals include the stability of blood glucose levels 2 hours after meals, and the ability to check the effects of foods and drugs.
I see. Then, why does a diabetic patient measure blood glucose levels before sleeping?
This is the same reason as fasting blood glucose level to avoid hypoglycemic shock. Having hypoglycemic shock during sleep could be dangerous for a diabetic patient. For the same reason, it would be good for a diabetic patient to measure blood glucose levels before exercise and after exercise to prevent hypoglycemic shock.
Exercise may dramatically reduce blood sugar levels. What else conditions may reduce blood sugar levels?
Diabetic patients may spend a lot of energy at work. Walking from building to building in the city or the university campus may also drop blood glucose levels due to energy consumption in muscle cells. Diabetic patients should be careful, especially when they feel dizzy, clammy, sweating, shaking, blurred vision, or fast heartbeat, which is a symptom of hypoglycemia. This situation can happen at work, in the mall, or on an airplane by spending energy, skipping a meal, having a low carbohydrate diet, or taking too much insulin.
Isn't it an emergency? Then, what kinds of foods should be taken?
When a hypoglycemic shock is concerned, diabetic patients need to decide what kinds of food to take by considering the degree of urgency. When it is urgent, high glycemic index foods, GI of more than 70, would be helpful. These include donuts and rice cakes. When it is not urgent, intermediate glycemic index foods, GI 55 to 70, would serve as a resolution. These include honey, raisins, pineapples, soft drink, and soda.
What about chocolate? It is sweet, so it may contain high sugar.
It is known that chocolate may have a lower glycemic index, probably due to the high amount of fat. Also, a banana may have a lower glycemic index, ripe banana at 51, underripe banana at 42.
Oh, the glycemic indexes, GI scores, of chocolate and banana are less than what I expected. Thank you for the information. What is the target range of postprandial, after meal, blood glucose levels?
The American Diabetes Association, ADA, recommends a target range of from 140 to 180 mg per deciliter for type 2 diabetes, from 80 to 130 mg per deciliter for type 1 diabetes 2 hours after the beginning of the meal. The target range would be less than 140 mg per deciliter for normal people without diabetes 2 hours after the beginning of the meal.
Wait, do you think the after-meal blood glucose levels need to be measured 2 hours after the beginning of the meal rather than after finishing the meal?
Yes, ADA's target range of postprandial, after meal, blood glucose levels was defined as glucose levels 2 hours after the beginning of the meal.
When diabetic patients measure their glucose levels, what kinds of devices can be used?
The most widely used device would be a blood glucose meter that requires finger pricks. More recently, people are considering smart insulin pens or continuous glucose monitoring, CGM, devices.
Are there any comments on how to improve the accuracy of blood glucose levels from a blood glucose meter?
Before measuring their glucose levels, diabetic patients need to wash their hands to wash away other materials related to glucose in their hands. It is also known that using alcohol may be much less effective than washing hands with soap. The personal blood glucose meter should not be shared with other patients, and the small needle called a lancet should not be reused to avoid bacterial infection.
When the amount of the first blood drop is small, is it okay to squeeze their finger to make more amount of blood drop?
Squeezing the finger may dilute the blood with normal interstitial tissue fluid, which induces less blood glucose levels. But, gently squeezing to get a drop of blood is a normal procedure.
Can they use the second drop instead of the first drop of blood?
The first drop of blood is typically more accurate. If the first drop is too small, patients need to prick their fingers again.
Which fingers should they use for the measurements?
The World Health Organization recommends that the middle or ring finger be used for the blood glucose test. The thumb or index finger may be more sensitive, and the pinky finger skin can become thin. There are other options including the palm at the base of the thumb, upper arm, and so on. When they want to change the body location to get a drop of blood, it would be good to contact healthcare providers to discuss.
Thank you for useful information and kind explanation. If this video helps the viewers as well, I would like to ask them to subscribe to Healthy Life 2050 and watch other related videos. Have a good one. See you soon.